So dig it, man. Yesterday, I had this new patient come in, right? He has diabetes and he has this wound in the bottom of his foot the size of a quarter, bro. And it was mad deep. It probed all the way down the bone. So you know how I get down, right? First thing I did after the initial examination was get an x-ray to make sure there was no bone infection. And fortunately, he did not have any signs of osteomyelitis, right? That's a good thing. So after that, did a quick non-invasive vascular exam, make sure he had decent blood flow. It was okay. You know, the ABI was about 0.75, so he did have some signs of occlusion of the blood flow. So he's going to vascular, and I think tomorrow to see if he needs any work to get his blood flow back going. But I mean, you know how I get down, man. I did a culture of the wound to see what the issue is with possible infection. The wound did have some little odor to it. I mean, you got the nose for it, right? So you know anaerobes when you smell it. It wasn't bad, but it was there. So we had to, give him antibiotics to start dealing with infection, good wound care. The big issue for a guy like this, man, is offloading. How are we going to keep somebody like this with a wound that size on the bottom of his foot? And he was a little bit obese, so how are we going to keep him off of his foot? You know, you still got to go around. You still got to take care of yourself. You still got to go to your other visits. You still got things to do. You still got to walk around his house to get to the dinner table, to get to the restroom, and all other kind of good stuff. So how do you handle that? Sometimes patients like this, it's not good to just put them on crutches because they don't have the upper body strength to use crutches and stay off of their foot. And it's very unrealistic to have somebody just stay in bed all day. That just doesn't happen, right? You know, people got things to do. So, what do you do for that? What would you do?